Hello everybody, my name is Marion McNabb and I'm a DRPH student in the Department of International Health here at BU, and I am part of an electronic data capture team that consists of Laura Carana, myself, and Dr. Chris Gill. So on behalf of the team, I'm presenting to you today about program and health data collection systems, both traditional paper-based and electronic systems. So I'm going to start off with a couple definitions. A health information system is really an overall system that integrates data collection, processing, reporting, and use of the information to improve health service effectiveness and better management. But a health management information system is a system specifically designed to assist in the management and planning of health programs as opposed to the delivery of care. So there's different types and elements of health management information systems, or HMIS systems. The first being the personal medical record, or the patient management system. So you can see in the photo at the bottom on the right, all those pink file folders are actually patient records. And then she's got a big log book where when a client comes to see her, she records the name and all different indicators for that client, including maybe diagnosis, drugs prescribed, referrals given, etc. Then you would have a hospital-based management information system where usually there's a statistician or a statistical unit that then would go around to each department in a particular time period and tally up all the results and all the data from each of the different departments for a hospital report. And that's usually sent to a district, then sent up to a regional, national, and oftentimes international level for reporting, which I'll talk about in a minute. So here you can see a snapshot of what a typical card room or patient record room looks like. This one is from Ethiopia, and you can see how many patient records there are and how difficult it is to probably locate, return the file to the right place, locate a particular patient's record. And then also, there's a real high chance that, patients' records could be lost in the system, like lost or left in one department and not returned back to the card room. So it's a very challenging way to manage healthcare data using paper. And while this guy is smiling so nice and he looks so happy, he probably has a very, very difficult job. And I'd have to say props to you for doing that job. So again, there's data, and data. There's a ton of data out there, but a real good HMIS system is the routine data collection of key indicators. You do not want to overload the system, and all non-essential indicators should be collected through special surveys like the DHS or cross-sectional studies, so that you can keep your data element points to a minimum that you can actually utilize them and not have to sift through unnecessary data points. So some other issues to consider is who compiles and receives the data, when is the data submitted, and in what form should the data be submitted. Should it be raw data? Should it be aggregate data? Should it be hard copy or electronic file? And when is the most appropriate time to use these different forms of data? So some principles for an effective HMIS system is that the content really should be timely and relevant for all users at all levels. Like I said, only the key indicators that are agreed upon should really be collected, but should be timely and relevant. And another one is that access at all levels of to this data, because it fosters ownership, ongoing use of the data, and learning about what's happening at any sort of level, so that you can really target your interventions and your finance spending and your resource allocation. And then another really key component is communication and promotion of data use and evidence-based decision making. So for example, if you see the trends and the incidence of malaria declining in one area and you've got a lot of money going in that direction, well, you can say, well, maybe I can shift some of my resources to another disease that is the incidence is increasing. So when you're looking at the quality of an HMIS system, there's some key elements to look at. The forms should be very simple, easy to use, and easy to understand for the person who's filling them out. And then you need to look at the quality of the data that's being collected. Is it accurate? Is it complete? Is it adequate? Is it timely? And then there's other components that are related to an HMIS system, like the processing of the data, the analysis, the dissemination, the supply and logistics related to data collection. Are the log books and the forms at the right places at the right time? Do we have the human resource capacity? And then one big one is the coordination of data collection among different units and levels of a government health system, meaning within one maybe health center or hospital, is there coordination between the different departments, and then also coordination from the district level to the regional level to the national level. And then complicating it all is the coordination with bilateral and multilateral partners and donors and even NGOs. So what type of data and information is collected? In terms of clinical indicators, these are usually decided at a national level and they're standardized across all public facilities. However, in my experience, some of the private sector facilities also voluntarily report so that the country can have a more comprehensive view of what's happening on the ground. So some examples of these would be like number of clients who've had a smear positive TB test result, or number of clients who were screened and treated for an STI. But then there's also process-related indicators that are programmatic, operational, or governance-related. So you can be tracking programmatic achievements, like the number of doctors who were trained in a particular health area, or tracking finances, or looking at your supply chain management and drug procurement systems, or adherence to certain policies or guidelines. So this schematic is a typical HMIS data flow. And on the right, you'll see the number 2s are the basic health indicators, the clinical indicators, the morbidity and the mortality data. And those start off at the health centers and move up the chain all the way to the Ministry of Health. And then on the left, you'll see there's this health services data, the manpower, the finance, and the epi data. That all goes up and then sifts over to the central statistical unit. Now, the dotted arrows are the feedback loops that are typically supposed to happen. Once the data has been submitted, then you're supposed to get feedback. Now, in this sort of scheme, it's almost like a game of telephone, because the data starts at the health center at the bottom of the screen, at the bottom of the graph, right? And then once it goes up from the district to the provincial to the central, you could lose data, the data could be misinterpreted, numbers could be entered wrong. You could drop off a 0 and you could have, said we only treated 100 patients when you treated 1,000. There's so many levels of possible error in this system, particularly if you're using a paper-based system where people are not necessarily statisticians and trained properly. So why do we want this data? What are we using it for? We really want to understand the burden or the severity of health conditions, and not at all these different levels. And we can also look at the programs and at all these different levels. It allows sites and all the regional and national levels to track performance against targets. So if you know how many clients you've served and you said that you were going to serve this many, you can gauge where you are in that process. And this helps make critical decisions on resource allocations for different health programs. Again, like I said, if you see a difference in sort of disease trends, then you can shift resource allocations among programs based on the data. So international reporting complicates HMIS systems quite significantly. Countries have to report to a number of international agencies on a number of different indicators. For example, countries report on progress towards the Millennium Development Goals, or countries report on different HIV/AIDS related indicators. And then there's sometimes a discrepancy between the national HMIS system or the data that they're collecting at the national level and then the data that's needed at the international level. So there may be differences in the actual indicator or the denominator or how the data is aggregated or deaggregated, the time of reporting. All of these things can prove to be very challenging for a country to manage. And so oftentimes what you'll see is there's extrapolation of data or estimates due to the lack of quality or availability of data or financial resources and local expertise. And then that data becomes less reliable to see about what's the real true picture of what's happening on the ground, because it's an extrapolation. So there's a lot of shortcomings to the current HMIS systems. Again, like I said, it's difficult to coordinate if multiple partners are involved in data collection and reporting. This happens, I've seen this in the HIV world, where you have 3 different partners working on the same programs, but they're all using different data collection systems. They're using different indicators with different denominators. There's underreporting because some people aren't collecting the data at the right time, and this undermines the whole reliability and validity of the data. And then, going back to our very confusing and telephone tag schematic, the healthcare providers and the community-based facilities usually don't receive feedback on their performance, and that's limiting the use of what data they've collected and submitted. And then there's often limited capacity and availability of human resources, not only for clinical care, but for statistical processing. And then in many countries, there's poor IT and internet infrastructure, which makes it challenging to implement more efficient systems of collecting data. And again, data collected on different diseases are often reported to different offices in the government system. And so you have silos where, the HIV people are not talking to the maternal child health people, and you're not talking to the TB and leprosy people. And so maybe you're collecting the same data, or maybe one program could be using another program's data, but there's no real way to integrate these systems so that you can have one pool of data to look at. And then there's, again, the reporting time lag. You saw how many layers it takes from one report to get up to the national level. So how useful is that data at the end? The final, another shortcoming is the paperwork burden on healthcare workers. So you see all these logbooks, and, they have a lot of clients. Maybe they're not a lot of healthcare workers. And if they don't understand the importance of having a complete data set, then, poor data in equals poor data out. And oftentimes these healthcare workers don't have enough time, they're not very interested, and they're not trained statisticians. So we can't be confident of what data is actually coming out of these places. But we're now seeing a shifting of gears happening from paper-based management of patient records and programmatic programs to now being put into electronic formats. And so you're seeing computer-based databases being set up where you still have your patient chart, but then you're entering that chart into a database, and then you can track trends over time. You can track patient data over time, and then you either submit that via the internet if you have the infrastructure, or you have people come around and you can mail data files, etc. A lot of this right now is very new, and it's focused a lot on HIV because that's the new sexy hot topic and where all the money's flowing. So a lot of it is, still being siloed in disease areas, and they're not so much integrated into the entire healthcare system. So what is really electronic and use of IT and technology for health? So what is eHealth and mHeath? Back to our definitions. So eHealth is the use of any type of technology to support health services, information gathering, and dissemination. And mHeath is the use of mobile devices to support real-time data collection, training, program interventions, all sorts of ways to use mHeath. And the most brilliant example that has happened so far in integrating technology into an HMIS system is Zambia. It's the first country in Africa to actually implement an electronic medical record system across the country, and a smart card, which is a personal medical record. So the EMR system is based off of a computer, and about 550 healthcare facilities in Zambia now use this system. So the patient has this card where every time they go to a healthcare facility, all of their information about what they've been treated, what's their diagnosis, what treatments they've been given, referrals, etc., are found on this microchip on this smart card, and they can transfer from facility to facility having all of their personal medical record information. And as you can see, Hillary Clinton was recently in Zambia touting the successes of this smart care and smart card project, and she has been quoted saying, "I've been trying to introduce this in America for a very long time. I need to bring a team to Zambia so that they can learn some lessons from the Zambians." Good luck. So some other tools, some other ways to use mHeath are using Androids or PDAs for data entry and submission. So, you can ask patients about different symptoms that they have, and it records it on the mobile phone. Or you can use SMS messaging for patients or for providers. So in this example, it's a SMS text sent to a patient to remind them to take their antiretroviral therapy on time and their vitamin C. You can also use GPS mapping, which is a very useful tool to either map disease burden or service coverage. And then you can also use different tools for clinical decision support. So you can have computer or handheld devices with specialized clinical decision-making algorithms that really help the provider make sure they've got the right diagnosis and that they're providing the right treatment for the right condition. You can also use telemedicine or video conferencing. This is an example of the National Teaching Hospital in Addis Ababa, Ethiopia, where clinicians in the national hospital present cases via this telemedicine and have virtual conversations with clinicians at Hopkins in Baltimore. And the clinicians in Baltimore provide advice to the clinicians in Ethiopia on how to care for that actual patient. So it's a very functional, practical tool for learning and also to improve patient care. And you can see there's a lot of, these are all medical students or residents that are there to learn. So it's also a CME, sort of a continuing medical education opportunity, as well as an opportunity to actually help real patients. So when is it appropriate to use eHealth or mHeath interventions? There's for programmatic interventions. So for example, you can use cell phones for home-based HIV counseling and testing. And you can, go house to house and test patients and then keep their recorded data and make referral slips and document referrals. You can also map households for malaria interventions. Or I've seen using cell phones where if you have to send specimens to a central lab, then the central lab can text message the cell phone back and say what the results are instead of a 2-month wait period for the results to get mailed back. They would have instant feedback on the results of a lab test to give to the client. And again, like I discussed, video conferences to train clinicians on new national guidelines or discuss cases. Then there's the patient level interventions. Like I mentioned, the SMS reminders to take medications or to come to your clinic appointment. You can have virtual patient medical records like the smart card, or pill bottles like the Wise pill bottle that record adherence levels and remind patients to take their medications on time. You can have clinic level interventions. So you can use different handheld devices to interview or do the intake of clients to make sure that you're collecting all the data and that you're not missing any data elements. So, you can program a phone in to where they can't move past a certain question without filling it in, so it improves the accuracy of your data. And then, again, the diagnosis of clinicians or provider learning. You can have different tools set up, like computer-based learning systems at the site, where clinicians can then, if they don't have access to internet, at least they can be on computers and learning more about new guidelines that are updated regularly when maybe support people come to the site. You can also use technology in emergency response. So you can use GPS to track resources or map needs or measure disease burden or see where all the program interventions are. And this was done in Haiti, particularly with one program called Health Map, if you guys are aware of that. And then you can use technology for disease surveillance in special circumstances. So there's been one project done for mass gatherings in the Hajj in Saudi Arabia where they had data collectors, trained data collectors down recording if there was an outbreak of any certain type of illness, and you would have rapid surveillance back up to the national level, and you could have GPS mapping and see where these clusters of outbreaks are happening so that you could stop them immediately. And then that would actually prevent the spread to other countries. It's kind of a brilliant approach. And then you can also use technology and mobile phones, data collection options for research and survey purposes as well. So some key points to keep in mind about using technology for health-related purposes is really you have to think about, are all the people at all the levels of the system familiar with technology? Are they familiar with like handheld, smartphones? Are they familiar with internet? Are they, maybe at a higher level they are, but at a community level, how familiar are they going to be? But then there's the issue of accessibility of power, internet, technical support at all levels. Is that available? So when you're going to implement this type of program, you have to think about these different components. And then using these mHeath or eHealth options for the right data collection and the right programmatic reasons, because you're going to pump in a lot of investment up front. So you need to make sure that you're doing it for the right data and the right programs. And then you also need to consider open source versus proprietary software systems, and we'll discuss this a little bit more in class. What would be more sustainable? If you're using a proprietary software system, you're going to have continuing license fees versus open source, which is free, but requires updating quite often. But how can mHeath improve these current systems? Well, it's pretty obvious. There's real-time data collection, processing, and analysis. You can be in Zambia right now and collect data on your phone, and it can be wirelessly transmitted to a server in Boston, where within 1 minute you can see what was collected in the field on your computer screen in Boston. So it's pretty amazing. It can accelerate interventions to prevent further morbidity and mortality. So you can be target shooting you can look at your data faster to make sure that, oh no, we have an outbreak of, this certain pathogen right here, so we need to act quickly, versus a traditional paper-based system. It can also strengthen the accuracy and timeliness of reporting. And then it's user-friendly, portable, and can be used in remote areas. There's actually very cool inventions coming out right now, like that would fight the issues in rural areas like lack of power or etc. Like, for example, there's a bike that you can charge your cell phone battery on the back of your bike, and while you're riding your bike, it charges your cell phone battery. So by the time you get to the next house to do your program intervention, your battery's charged, so you don't necessarily need power. Or there's solar battery chargers. There's a whole field, emerging field of using technology, integrating technology into health, and it's very exciting because it's engaging engineers, it's engaging public health, it's engaging IT folks. So it's a pretty exciting time to be in this field. So now that you've heard me talking for a little while, we're about to get our feet wet and our hands dirty in the class session, and we're going to learn how to develop forms, data collection forms, collect the data and analyze the data, all using a cell phone and the internet. So look forward to seeing you in class in person, and until then, have a great day.